Good afternoon, everyone. My name is Paulette Flamond, the Métis Nation of British Columbia Minister of Health. As well, I'm also the Director for Region 7 here in the northeastern part of British Columbia. I'd like to start by acknowledging the shared traditional territories from which we are all phoning in today. I am proud to be here on the traditional territory of the Beaver Dunaza people here in northeastern British Columbia, as well as the traditional homeland of the Kelly Lake Métis people. Before I invite Elder Marie Bercier to provide an opening prayer, I'd like to acknowledge a few people on the call. We have Dr. Bonnie Henry, the Provincial Health Officer, Dr. Danielle Bain-Smith, the Deputy Provincial Health Officer for Indigenous Health, as well as Tanya Davaran, MNBC Senior Director for Health. Before we begin, I'd like to take a few moments to acknowledge the tremendous work and partnership that went into the Métis Public Health Surveillance Program, the Baseline Report. Métis people in BC are a group that have historically been marginalized and overlooked. While there has been great strides in the development of programs, policies, and services for Indigenous people, the unique needs of the Métis people are often overlooked. This report helps to achieve a good first step in identifying the specific strengths and challenges of our Métis citizens and our Métis chartered communities. I am incredibly proud of the collaborative partnership between MNBC, the Office of the Provincial Health Officer, and the BC Ministry of Health. Over the next 10 years, we will have a plan to monitor and report on the health and wellness of Métis people in BC. The voices of our communities and citizens are embedded throughout this report, with their lived experiences guiding the document. MNBC will continue to advocate for resources, programs, and services that are culturally relevant to Métis people here in British Columbia. Again, I'd like to acknowledge and thank all the participants, the collaborators, and partners. I'd now welcome Elder Marie Bercier to provide an opening prayer.
Thank you, Paulette. Can you hear me? Am I on? Okay. I reside and work and play on the traditional and ancestral territory and unceded territory of Stolo Coast Salish people. We are grateful to our sisters and brothers for this opportunity to live, work, and play on their ancestral lands. We honor the ancient ones who may be interred in these lands, and we ask for their blessings and guidance to remember to love and protect Mother Earth as they did. Creator, today we are gathered here to learn from each other how to better serve our Métis community. Help us to remember to have open hearts, minds, and eyes. Creator, help us to remember that we are all one in your vision. We ask that you grant us the strength, humbleness, and resilience for the challenges ahead that we may treat each other as we would like to be treated, as equals. To accept that with this health challenge for our Métis citizens, we would all work together in order for our healthcare system to continue to learn, understand, and support our Métis community. We ask, Creator, and require all who are tasked with this need to please support and understand that our culture is very important to our physical and mental health. Our culture encompasses a set of distinctive, spiritual, emotional, intellectual, languages, art, food, lifestyle, music, science, and educational ways of living together with our value systems and traditions. All must be combined to make for a better result, health-wise, mentally, and physically. Creator, grant us that our healthcare system can learn to encompass all aspects of who we are as Métis citizens without any hesitation when called upon. For this, Creator, we shall be grateful and we shall be blessed, for we are all one, sisters and brothers. Aho to all our relations. Amen. Merci and thank you.
Wow, thank you so much, Elder, for the powerful prayer. It actually is bringing tears to my heart and to my eyes that we all want to see better health outcomes for Métis people in all across our homeland. So thank you very much. So I would like to present Dr. Bonnie Henry and Dr. Baines Smith to provide the presentation to you all today.
Merci. Thank you so much, Minister Flamond, and thank you so much, Elder Bercier, for your opening words and opening prayer. They really resonated so deeply with me as well. And I was particularly excited because as you listed so many of those things that make us whole and well as Métis peoples, I think we really are embodying a lot of that and doing our best to embody that in this program. So it's wonderful to be with you this afternoon in this circle. My name is Danielle Baines Smith. My paternal links are Echo Dene to Fort Nelson First Nation in the northeastern part of what's now known as British Columbia, colonially known as British Columbia. And my maternal links are to the Red River Valley. I am French Canadian and Métis from the area around Thibautville, Richer, Sainte-Anne. So it's really wonderful to be joining you today. And I'd like to, on behalf of myself and Dr. Henry, acknowledge that we are grateful to be calling in from the territory of the Lekwungen peoples of the Songhees and Esquimalt nations, and recognizing all of the Métis citizens who also now work, live, and play on these lands. We're really to be here today to present Tanse Kia, Miyayo Métis Santi, Pi Mayoyan Didan BC, our baseline report, which translates to how are you, Métis health and wellness in BC. And I really have to give a big thanks to Lauren Peterson at Métis Nation BC for helping to coach me and help me get my Michif pronunciation at least hopefully closer to where it should be. Next slide, please, Nick. Before we delve into the presentation, I just wanted to take a moment to share with you that my two kids celebrated two really important events this fall. So one was that they got their vaccination, and two is that they were they received their citizenship with Métis Nation BC. So all of their genealogical records were verified, and they are now two of the, I think, probably the newest members of Métis Nation BC and here with Métis Nation Greater Victoria. And I was so pleased that this photo of my daughter Maeve with her Métis sash in the front was actually picked up on news outlets across the country. So it was really important to us on that really special day of getting vaccinated that we were able to be there as a very visible Métis family. And so I was pleased that that got shared everywhere, because this is one really important part of keeping ourselves and our elders safe during this COVID-19 time, and wanting to acknowledge also, before we move into the rest of the presentation, perhaps we can offer an early happy birthday to Elder Marie Bercier, who shared that she'll be celebrating her 80th birthday in a couple of days. And so I think that all of us and our families and our children going out to be vaccinated is one of the really important ways that we can honor and hold up the value of elders like you, Elder Bercier, in our community, and all of the teachings that you share with us. So I'm going to be talking in a moment about the what about the report, this baseline report and recommendations. But before we do that, I'm going to turn it over to Dr. Henry to talk a little bit about the how, which I think is really the foundational and probably fundamentally one of the most important pieces of this program is our collaboration. So I'll pass it to you, Bonnie.
Thank you very much. And if we can go to the next slide. So this is something that our office has been working in a collaboration on with Métis Nation BC for 5 or 6 years now. And it's something we are committed to and something that I'm incredibly proud of. And I do want to as well acknowledge Elder Bercier. Thank you so much for opening us up with those words. And Minister Flamond, this is a first step. And it's a first step in our commitment to distinctions-based reporting and around Métis data governance, and acknowledging and recognizing both the strengths and the challenges for Métis people in British Columbia. And it is a first step because we are committed to this ongoing working together. We have done this at every stage, even when things were complicated, and our relationship continues to grow and evolve. And we are all dedicated to ongoing Métis health surveillance with the goal, the absolute goal, of improving the health and wellness for Métis people here in British Columbia. And the next slide. So this is, as you have heard, a 10-year surveillance initiative, and it is our intent, and we are committed to working together with my office, Métis Nation BC, and the Ministry of Health to fulfill those responsibilities we have to understand and report on the health of the population of British Columbia, and in this case, focusing really on Métis Nation BC. So we know that there are about 90,000 self-identified Métis people in British Columbia, according to the 2016 census, and this is about a third of the Indigenous population in British Columbia, and 22,000 Métis citizens are registered with Métis Nation BC, along with Maeve and Lucy from Danielle's family. And Métis Nation BC is the recognized government for Métis people in BC. And an information sharing agreement we developed over the last number of years enabled the creation of what we call a Métis cohort. And this means being able to look at a full spectrum of data that helps us support the health and wellness and understand the challenges facing Métis people in BC. Our current commitment is a series of 4 joint reports on Métis health and wellness, and this, our baseline report, is the one that we're talking about today. We have 2 interim reports and a final report in 2030, which seems like a long time away, but I know it will come very quickly. Our commitment, however, to Métis health and wellness is ongoing. And by the time we get to 2030, I hope we will have a transformational relationship that will lead to improvements, not only in access and understanding of health and wellness, but true meaningful improvements in health. If we go to the next slide, as I mentioned, this Métis cohort that we've pulled together includes health data on registered Métis citizens, and some of it is supplemented with other databases from other sources, including people who self-identify, some data we have. Although it is one of the things that we've recognized early on is that there are gaps in understanding, and the question is often not asked on many different health databases that we rely on to understand population health. But we do have some from the BC Adolescent Health Survey, from the Canadian Community Health Survey, census data, and some published literature and studies that have been done. And this report gives our priorities, recommendations, and targets for Métis health and wellness over the next 10 years. And it's a holistic focus, because we know that it's not just health care that leads to health in communities and families. It's a focus on Métis culture, rights, and governance as integral to health and wellness as we move forward. I will also say that this partnership has helped us in a number of ways already, including helping us understand the impact of COVID-19 on Métis nations and Métis people in British Columbia, on understanding vaccination and how the vaccine rolled out to Métis people in BC, and of course, access to Métis overdose data in the other crises that we're dealing with today. So this, I believe, is a foundational step that is going to help us understand how we are making progress in supporting health and wellness in Métis people in British Columbia. And I will now turn it over to Danielle to walk you through some of the key parts of the report.
Thank you. Thank you so much, Dr. Henry. Nick, if we, oh, he's ahead of me. Perfect. We're in sync. So one of the really excellent shifts, I think, in this collaboration and form of reporting is really leading with Métis strengths. So ensuring that we have Métis strength and resilience at the forefront of every section, of every sentence. That was a principle that we really wanted to stick to. And so I think you will see that as you go through the report online, you'll see that cadence to the report. However, it's of course critically important that while we highlight and emphasize our strength and resilience as Métis peoples, that we also shine a bright light on the ways in which systematic and pervasive and ongoing racism, discrimination, structural colonial violence continue to negatively impact our health and wellness. The next slide, please, Nick. And so this is where I was referencing, I think there's these wonderful connections between Elder Bercier's opening and what this baseline report and this program is really showing us, which is that cultural connectedness and recognition of Métis identity are linked to improved health outcomes for Métis peoples. And we'll dig into a little bit more of the specifics on the next slide. So from the 2018 Adolescent Health Survey, it was clear that Métis youth who reported participating in traditional or cultural activities were more likely to volunteer and to feel connected to their community. Métis youth who felt connected to the land and nature were more likely to report good or excellent mental health, and that they managed stress better or very well. And so these are really important findings, as are the words of Métis peoples. Next slide, please, Nick. Another important principle that we've embedded into the program and into this baseline report is that we want to have a holistic perspective and holistic sources of data about and from and with Métis peoples. And so that for us, that means that the stories, voices, narratives of Métis peoples are as valid and important as some of the graphs and charts and figures that I'll show to you in a moment. So here is one of the examples of the ways in which Métis people's voices are featured in this baseline report. And I would draw attention to the last sentence here from Gary James Tetu that says, "I wish there were more opportunities locally for Métis culture to be incorporated into people's lives and routines." And so that really resonates with the opening that we received. And I think you'll see that we've pulled that thread through as we move into the priorities and recommendations in just a moment. Next slide, please, Nick. As we transition into some of the figures and charts and quantitative data that are featured in the baseline report, I do want everyone to keep in really sharp focus what is being measured. The findings and charts that we'll show in just a moment really are illuminating the impacts of being subject to colonial practices and policies, and how we continue to be harmed as Métis peoples by the cumulative impacts of systemic racism, colonization, and social exclusion. And that gets translated into higher rates of chronic conditions. And the reason I want to emphasize this point and this context is because I think for many decades in population health reporting, there's been this implicit understanding or belief that Métis identity or Indigenous identity is a risk factor, because we see and we're inundated and we've actually normalized looking at data that represents health inequities that show that Métis people are sicker than other people. And so I think it's so important that we really emphasize and we are disciplined in the way that we speak to this data, because as we've just shown you and as Elder Bercier has said, Métis identity is a source of resilience. It is not a source of harm. It is not a source of risk. Who we are is what gives us our strength and our health and our wellness. And so as we move through the next set of slides, it's really important for us, thank you, Nick, to see that what we're seeing in a chart such as this, where diabetes prevalence is higher among Métis than other residents of BC, that this is entirely a finding and a result that is socially constructed, that is tied to the deeply embedded ideologies of white supremacy and anti-Indigenous racism. And so that's where we need to focus our efforts to improve health and wellness. These metrics, however, and we can go to the next slide, Nick, such as these that show us that, Métis people or people in the Métis cohort, so citizens of Métis Nation BC, are significantly higher prevalence of COPD, or that asthma prevalence is significantly higher for Métis females than any other group in the province. These types of findings are going to be really important metrics for us over the next 10 years and beyond, as we try and dig deep to untie those colonial knots and structures and policies that continue to create these health inequities. Next slide, please, Nick. One area that's been very, very important and a priority focus is around mental health. And so this, the findings in this baseline report really just emphasize and amplify what Métis communities, community members have been saying for many years and advocating, which is that, Métis youth are reporting more mental health concerns than other youth. If we can move to the next chart or next slide, please. This is another way in which the data is presented in the baseline report in these infographics. I'm trying to make this information as accessible as possible, and really, again, emphasizing that there is a discrepancy, there is inequity. And when we're looking at Métis youth mental health, young Métis women are really in a group that needs focused attention, love, care, and concern. Next slide, please. We see that that trend that we were just looking at amongst youth does translate and carry on through the life stages. And that was another important principle for the program and the baseline report, is to be looking at things and looking at health across the life course, recognizing that each stage has its own importance and sacredness in that life course journey, and that needs its own specific attention and care. And so you will see, and as we move through some of the targets, that we do look across the life course. And so again, I just really want to bring home this point that everything that we've seen up until this point, and everything that's included in the baseline report, really speaks to the strength of Métis peoples, our culture, our way of being, our music, Elder Bercier, that you mentioned, and that these inequities that we're seeing really are tied to enduring and deliberate colonial practices and policies. And so all of us collectively, all of us that are in this circle today, all of the ministries who have received a copy of this report, the legislature, which will be receiving a copy of this report as one of Dr. Henry's annual reports. All of us need to work together and come together to get our hands messy. This is hard work that we have to do, and we can't do it alone, any one of us. So grateful to be in the circle today, and recognizing that the circle goes far beyond even those who are joining today, to our lawmakers, our policymakers, and people that are working in the healthcare system. So that brings us to the priorities. Nick, if you can can bring us to the next slide, and recognizing, as I just said, there's many, many hands that need to be involved in bringing these priorities and the recommendations to life. So the 4 priorities that we've articulated are improving Métis health and wellness through upholding Métis self-determination, fully realized mental health and wellness for Métis people, lifestyle as medicine for Métis people, and collaborative, robust, self-determined Métis health information systems. And each of these priorities is linked to a specific recommendation. And Nick, if we can move to recommendation number 1. This recommendation focuses and builds on the October 2021 letter of intent, which committed to establishing a BC Métis relations working table. And our recommendation focuses on the potential for a Métis health and wellness sub-working table that would focus on specific accountabilities to Métis cultural safety and cultural wellness, and a health system that's responsive to and inclusive of Métis peoples, including increasing the number of Métis healthcare professionals, which, as we saw, is featured in the report around Métis physicians, is absolutely a tiny fraction. You can barely see it on the graph because it's so small compared to non-Métis physicians. So that's one example, but we know that that needs to be hardwired and embedded across all of the various healthcare professions. Nick, if we can please move to recommendation number 2. This is falling on the priority of fully realized mental health and wellness. And so our recommendation focuses on a Métis mental health and wellness action plan to improve holistic mental wellness, reduce problematic substance use, and address harmful effects of colonialism, assimilation attempts, and a residential school, among other intergenerational traumas that we've endured. And we, as I mentioned at the outset of this section, these priorities do call on many, many hands to be involved. And so as you go through the report and through the recommendation section, you'll see that we've proposed co-leads. So in relation to this recommendation, we've proposed co-leads being Métis Nation BC, Ministry of Mental Health and Addictions, and Ministry of Health, and then supportive actors or collaborators that could be involved. So you'll see that with each recommendation, we structured it in that same format. We can move to recommendation number 3. Thanks, Nick. I just love this recommendation, lifestyle as medicine for Métis peoples, because I think this is one of the ways in which we are deliberately disrupting the status quo, and maybe some of the ways mainstream population health focuses on prevention or other aspects of population health. And for me, this is about really, again, uplifting who we are as Métis peoples and recognizing that we are inherently, innately knowledgeable about how to lead healthy lifestyles. Like, that's something that I believe is embedded in our DNA. Our ability to carry that out is absolutely influenced by these different colonial barriers that are out there and the ways we're impacted. But this is really, the recommendation is to develop an action, a Métis lifestyle as medicine, health and wellness strategy that recognizes, reflects, and builds upon Métis cultural traditions and values. So I'm very, very excited about watching how this particular recommendation evolves and unfolds over the next 10 years and beyond. And then recommendation number 4 is focused on a culturally safe, self-determined Métis data collection and monitoring processes that uphold Métis data governance standards, identify Métis people, citizens, and self-identified within provincially held data sets. So it's this this program, the collaboration, the partnership has really helped us to see how critically important data are. The quantitative data, the qualitative data that I was speaking to before. Dr. Henry mentioned how helpful it's been to have this program that was underway and had the infrastructure that allowed us to hit the ground running when we were met with this specific health hazard of COVID-19, the overdose data that will be forthcoming, and recognizing that we are going to see future shared challenges, whether it be related to climate change or how COVID-19 will unfold. And I really want to lift and raise my hands to Tanya Davrin, her team that worked with us closely to make the cohort a possibility to be a part of this initial visibility. But this recommendation is speaking to how that needs to really be expanded, and how we will work to do that together, and hopefully in collaboration with other government partners like Ministry of Citizen Services to do that important work. The next set of slides, and I won't read through them all in detail, I'll let people do that as they go through the report on their own, but what I want to draw your attention to is that we do have targets, because this isn't a one and done report. This is one snapshot in time, but it's one that's going to inform our ongoing collaborative reporting. And so this is a program of surveillance. We have targets around cultural wellness and lifestyle. The next slide shows us targets around supportive health systems, and targets specifically around mental health and wellness, and a section that looks at targeting Métis rights and governance. I hold the personal belief that the most fundamental determinant of health is self-determination. And so I'm so pleased that together as a partnership team, we were able to include this as a really foundational piece to track around Métis people's health and wellness. The next slide speaks to foundational commitments that this government, the federal government, have made to upholding Indigenous people's rights, upholding the Truth and Reconciliation calls to action, the missing and murdered Indigenous women and girls calls for justice. As I mentioned earlier, the letter of intent that was signed in October of 2021, and the PHO, the Office of the PHO, reporting responsibilities under the Public Health Act. So this program, this baseline report, is one step in terms of all of us, and now I'm speaking on behalf of my mainstream colleagues and decision makers, lawmakers, to demonstrate our trustworthiness to Métis citizens, to Métis peoples. I think that that's such a critically important element of reconciliation, is to repeatedly come back to the circle in a good way that demonstrates our trustworthiness. And hopefully this is one demonstration today, and we'll demonstrate it over our subsequent 3 reports. And we really look forward to seeing how we see progress in many of these indicators. The last penultimate slide includes this beautiful quote from Monique Auger that reads, "Métis people understand the issues in their communities and should play an active role in designing the research projects and translating them into program implementation, policy development, and social change." So absolutely, these words should really move something in each and every one of us. And I do hope that my colleagues that are listening here today, that are reading the report over the days and weeks to come, are really thinking about concretely, what is it that they are doing in their day-to-day actions to honor and uphold the rights of Métis peoples to health and wellness here in BC. So on behalf of the entire program team, I really do want to extend our sincerest gratitude to everybody that's contributed to making this baseline report a reality, a long-awaited reality. Merci, merci, thank you, Heichka, and I will pass it back to you, Minister Flamond.
Well, thank you so much, Dr. Bain-Smith, and thank you to everyone who actually played a role in bringing this report to life, because it took, like as you said, many hands, and it'll continue to be many hands. So that concludes our event today. Merci to everyone from across Canada who participated with us today. We appreciate it.